Welcome back to the deep dive. Today, we are taking on one of the most misunderstood pieces of the U.S. financial landscape.
The health savings account, the HSA.
Exactly. And most people, they just treat it like a checking account for their medical bills.
Right, just a simple spending vehicle.
But we are going way beyond that today. Our goal is to detail exactly how to go all the way with HSA to turn this thing into a powerful, triple tax advantaged retirement vehicle.
And it is, hands down, one of the best tools the IRS allows right now.
It's an incredible tool, but you just hit on the key point. It's complex.
Very. It lives at this weird intersection of, tax law, retirement savings, and healthcare planning, which means the rules are, well, they're numerous and pretty unforgiving.
So our mission today is to take a deep dive into our sources. We've got a detailed guide on the 2025 rules and a comparative analysis of U.S. healthcare costs.
Right. So we can give you the playbook. We're going to focus on eligibility traps, how to map out your contributions, and then the really critical long-term strategy that unlocks its true power.
Okay, let's get into it. Starting with the foundation. You literally cannot have an HSA unless you are enrolled in a specific kind of health plan.
A high-deductible health plan, or HDHP.
And that link is, it's non-negotiable. It's baked right into the tax code.
That's right. The HDHP is the gateway. So to really get the HSA, you first have to understand how that health plan is structured. It's different.
Yeah.
It puts more of the financial responsibility on you up front.
We should probably define the pillars of that cost sharing, right? Co-pays, deductibles, co-insurance.
Definitely. A copay is that fixed fee you might pay for a doctor's visit. But with HDHPs, you usually don't have those until after you meet your deductible.
And the deductible is the big number.
That's the critical number.
Yeah.
It's the amount you have to pay completely out of pocket every year before your insurance really starts to kick in for major costs.
And after that, you've got co-insurance.
Which is just that percentage split, say 80-20. The insurance pays 80%, you pay 20% until you hit your final safety net.
The out-of-pocket maximum. So for a plan to even qualify as an HDHP in 2025, there are specific IRS minimums. What are the numbers we're looking at?
Okay, so for 2025, the minimum deductible is $1,650 for employee-only coverage.
Just for one person.
Yep. And it's $3,300 for family coverage. And maybe even more importantly, the absolute cap, the most you could possibly pay out of pocket, is $8,300 for an individual.
And for a family?
$16,600.
Right.
If your plan goes over that cap, it's not an HDHP, and you cannot have an HSA.
Wow. That $16,600 number is exactly why the HSA is so necessary. But there is one major bright spot in that structure people might miss.
The exception for preventive services. The IRS lets HDHPs cover preventive care at 100%, even before you've met your deductible. So things like your annual physical, immunizations, certain screenings.
Even some weight loss programs.
Exactly. All of that is often covered from day one. It keeps basic wellness affordable.
That's a key detail. Okay, now let's get to the good stuff. Why we're even doing this. The triple advantage.
This is what makes it so unique.
Yeah.
It's just so much more tax efficient than a 401k or an IRA.
Break it down for us, the 3 points.
Okay, first, your contributions are pre-tax. And if you do it through your employer's payroll, through what's called a Section 125 cafeteria plan.
Which most are.
Right, then that money avoids income tax and the 7.65% FICA taxes, Social Security and Medicare.
That FICA tax piece is huge. That's the detail that really sets it apart.
It is. Second, the money grows completely tax-free, just like in a Roth IRA. And third, when you take it out for qualified medical expenses, the withdrawal is also completely tax-free.
Deduction on the way in, tax-free growth, tax-free withdrawals.
You can't beat it.
You really can't, assuming you meet all the requirements. Which brings us to our next section, because this is where the IRS sets the landmines.
Disqualifying coverage.
It's the most common way people accidentally get themselves in trouble.
Absolutely. So, besides having an HDHP, you must have no disqualifying coverage. And this is where it gets tricky, especially with spouses and dependents.
Let's start with the number one offender, the General Purpose Health FSA, the flexible spending account. How can something that sounds so helpful just blow up your HSA eligibility?
It's a structural problem. An HDHP, by definition, requires you to pay your deductible first. But a general purpose FSA?
Or a standard HRA.
Right, or a health reimbursement arrangement. Both of those will pay for general medical expenses before the deductible is met.
Which breaks the HDHP rule.
It violates the core design, so you can't have both.
So wait, even if the FSA is through my spouse's company and I've never even used it, just the fact that I could use it, I'm blocked.
Precisely. If your spouse enrolls in a general purpose FSA, even if you are on a completely separate HDHP, Neither of you is eligible for an HSA for that entire plan year.
Wow.
It doesn't matter if there's a zero balance. The mere existence of that coverage disqualifies both of you. You have to coordinate very carefully.
That's a huge trap. Now, it does make sense, the limited purpose FSAs, the ones for just dental and vision.
Right. Those are...
Because those expenses aren't subject to the main deductible anyway.
That's the distinction. They don't undermine the deductible structure. Same with most EAPs and employee assistance programs, as long as they don't provide, quote, significant benefits in the nature of medical care.
So mental health counseling is usually fine.
Generally, yes.
Let's talk about another eligibility killer. This one targets older workers, the Medicare trap.
This is a massive one for anyone working past 65. Enrolling in any part of Medicare A, B, C, or D is immediate disqualifying coverage.
But the real danger is retroactive, right?
Yes, specifically with Medicare Part A. If you sign up for Social Security benefits after you turn 65, the government automatically enrolls you in Part A. And that coverage can be backdated by up to 6 months.
Oh, that's bad. So if you were still contributing to your HSA during those 6 months...
You now have excess contributions. You were retroactively covered by Medicare, so you were ineligible.
So what's the bottom line?
You have to stop all your HSA contributions at least 6 months before you apply for Social Security. If you don't, you've got to take that money back out, or you'll face a 6% penalty tax every single year.
That's a critical date to put on the calendar. Okay, speaking of rules, let's talk about the end of the COVID-era relief. Things are snapping back to normal for 2025.
They are, and it's causing some confusion. For plan years starting in 2025, that special rule allowing HDHPs to cover COVID testing and treatment before the deductible, that's gone.
So those services are now subject to the deductible again.
Generally, yes. And the same thing happened with telehealth.
Which exploded during the pandemic. Everyone uses it.
Right. But the relief that let plans waive the deductible for telehealth also expired at the end of 2024. This is a major change.
So now a telehealth visit, unless it's strictly preventative care, has to go toward your deductible.
Correct. And if a company is still waiving that deductible for telehealth, they might be accidentally disqualifying all their employees from having an HSA.
That is a huge compliance check for HR departments and for you as the employee. You have to pay attention. Okay, let's pivot to the fun part. Maximizing contributions. What are the 2025 limits?
The limits for 2025 are $4,300 for individuals and $8,550 for family coverage.
And family coverage is just anything other than self-only.
That's right.
What about the catch-up for those 55 and older?
They get an extra $1,000. And if both spouses are over 55 and eligible, they can each contribute that $1,000, but it has to go into their own separate HSA accounts.
But they share the main family limit.
They share the $8,550 and can split it up however they want between their two accounts, plus their individual catch-ups.
Okay, this is where it gets really tricky. What if you become eligible or lose eligibility in the middle of the year? You can't just dump in the full amount.
No, if you do that, you risk that 6% excise tax. The default rule is the proportional contribution rule.
So you calculate it month by month.
Exactly. It's 1/12 of the annual max for every single month you were eligible. So if you start a new job with an HDHP on September 1st...
You're eligible for September, October, November, December. 4 months.
Right. So you can only contribute 4/12 of the annual limit. If you put in the full amount, you have an excess contribution. You have to take that money out before the tax deadline to avoid the penalty.
That's the safe way to do it. But there's a famous high-risk exception, the last month rule.
This is the aggressive move. The rule says if you are HSA eligible on December 1st of a given year,
Just that one day.
just on December 1st, then you are allowed to contribute the full annual limit for that entire year, even if you are only eligible for that 1 month.
That's a huge acceleration of savings. So what's the catch? There's always a catch.
And it is a nasty one. It's this extremely punitive probation period. They call it the 13-month testing period. Meaning you have to stay HSA eligible for the entire next year, from January 1st all the way through December 31st. And if you fail, say you switch to a PPO in June,
What happens?
the entire amount you accelerated is now considered taxable income. And on top of that, you get hit with a 10% additional tax penalty.
The 10% penalty. Wow. And unlike a normal excess contribution, you can't just fix it by taking the money out.
Nope. That 10% penalty is absolute if you fail the test. It is a huge gamble if you think there's any chance your job or insurance will change.
So only do it if you are rock solid on your eligibility for the next year. And all of this gets reported on Form 8889 with your taxes.
That's the one.
Okay, let's shift gears completely to the distribution side. The strategy that really turns the HSA into a retirement superpower. We call it the shoebox rule.
This is the hidden genius of the HSA. If you're just using your HSA to pay today's medical bills, you're missing out on decades of tax-free growth.
The shoebox rule is about delaying reimbursement.
Indefinitely.
So instead of using my HSA to pay a $2,000 bill today, in 2025, I pay that bill with my regular checking account. I save the receipt.
In a literal or digital shoebox.
And I just leave that $2,000 invested in the HSA, growing tax-free.
Exactly. And over 30 years, that $2,000 might grow to $10,000. Then, when you retire in 2055, you can pull out that original $2,000 completely tax-free.
So you're turning old medical receipts into a tax-free line of credit for retirement.
That's the perfect way to describe it. The only rules are you have to keep good records, and you can't have been reimbursed from somewhere else for that expense.
And what counts as a qualified expense has gotten a lot broader lately, which helps.
Yes, the CARES Act permanently expanded the list. Over-the-counter medicines no longer need a prescription. Menstrual care products like tampons and pads now count.
And PPE, right?
Yep, personal protective equipment, masks, hand sanitizer, all of that, going back to January 1, 2020. It expands the universe of receipts you can put in your shoebox.
There is one really critical timing rule, though. The account has to be established before the expense happens.
This is the bad timing trap. The IRS is very clear. The expense has to be incurred after the HSA is officially established. And that usually means when it's first funded.
So if my HDHP starts January 1st, but my first paycheck contribution doesn't actually hit the HSA until April 1st.
Any medical bills you had in January, February, or March can't be reimbursed. Ever.
Unless you had a previous HSA.
Correct. There's an 18-month exception if you're rolling over from an old one. But for anyone opening their very first HSA, you have to get that first dollar in the account as fast as possible.
The level of detail here is just incredible. Okay, let's zoom out. We've just spent all this time detailing the rules for this one financial tool. Why is all this financial engineering even necessary in the U.S. healthcare system?
This is where we connect it all to the bigger picture. The HSA is really a response to the uniquely high cost of healthcare in the U.S.
And our sources have a pretty stunning comparison with Canada.
They do. In 2022, the total healthcare cost per person in the U.S. was $12,555.
Okay. And in Canada?
In Canada, it was $6,319. Roughly half.
We spend double. And that's not just private spending. The data shows the U.S. government actually spends 23% more per person on healthcare than the Canadian government does.
A lot of that difference is administrative complexity. Older data suggests administrative costs in the U.S. are around 31% of all healthcare spending. In a single-payer system like Canada's, it's closer to 16%.
All the different insurance companies, billing systems, it just adds friction and cost.
Enormous friction, which drives up the cost for everyone.
So we spend double the money. How do the outcomes compare? This is where you see the trade-offs.
The outcomes really reflect different priorities. Canada guarantees coverage for medically necessary care for all its citizens. They prioritize universal access. The trade-off is speed.
The infamous wait times.
Exactly. One survey showed 43% of Canadians waited 4 weeks or more to see a specialist. In the U.S., that number is only 10%.
Because in the U.S., access is all about who can pay.
It's dictated by funding and insurance. If you have the right insurance, access can be immediate. If you don't, you could face, crippling medical debt.
And the ultimate metric, life expectancy, tells a pretty stark story.
It does. Despite spending twice as much, life expectancy in Canada in 2021 was 82.6 years. In the U.S., it was only 76.3 years.
So the high-cost individual funding system that makes the HSA so necessary, it doesn't actually translate to better health outcomes for the population as a whole?
No, it doesn't. And that really brings us back to the strategic tension here. The HSA is an exceptional tool, but its very necessity highlights the huge risk and financial burden placed on the individual consumer in the U.S.
So understanding these rules, avoiding the FSA trap, minding that Medicare window, mastering the shoebox rule, it's all about building a personal defense against those systemic costs.
That's what this deep dive has been about. Creating your own personal health security through financial savvy.
Okay, so to sum it up, the HSA is a personal finance superpower. But it demands your attention to the details, the eligibility rules, the timing, the risk of something like the last month rule.
And the ultimate prize is unlocking decades of triple tax-free growth with the shoebox rule.
We've established that in the U.S. system, maximizing this tool means you're effectively transferring the burden of your future medical costs from an insurance company onto your own investment timeline.
You're taking control.
Right. But what stands out to you is this. If the HSA becomes the primary way we're all expected to handle catastrophic healthcare costs in retirement, what does that mean for the future of health security? When the quality of your care hinges less on systemic reform and more on your individual ability to navigate complex tax codes and manage a multi-decade investment portfolio, we'll leave you with that thought.